Ms. Buckner, what stages and processes do you see families undergo when making the transition between home and into a facility?
I see the families go through the stages and processes, mainly the stages of guilt and grief. Grief is a big one, going through the grief process of what they thought was going to be and now what is really happening with their loved one, and educating them that they are still the caregiver. It's actually just a different type of caregiving, and that they can concentrate more on being an emotional caregiver rather than the burden of taking care of the physical part of caregiving. A lot of times we see patients come in and out of the hospital in acute care setting, and it takes the family several admits into an acute care setting before families realize that the patient is actually more safe and better off in a long-term care setting than they are at home. And so sometimes it takes several stages for the family to realize that this is better off for them, and especially for the patient.
When psychotropic drugs are indicated, how do we best choose the medication and monitor for safety?
Again, that goes back to which psychotropic class we're talking about again, because there's so many of them. If we're talking about specifically antidepressants again, what we use a lot of time in our geriatric patients is going to be medications such as sertraline or citalopram. That belongs to a class of medications called SSRIs, or selective serotonin reuptake inhibitors. With those medications, we normally keep track of how the patient responds to them. Are they sleepy? So is there increased sedation, or does it make them a little more active? And based off of those factors, we can move the medication to the morning or the evening. And those can easily be seen by other patients or other caregivers, and they can help us by communicating with us of how we can adjust those medications to better take care of the patient as well. And so monitoring factors just by how the patient responds in those ways too. There are laboratory parameters that we check for, sodium levels and things like that too. And then with antipsychotics, like we talked about earlier, those have more metabolic risks that we have to take into consideration. They can affect a patient's blood glucose or their blood sugar levels, and so we have to monitor those. It can cause some weight gain if they're kept on it for too long as well. And several other things, there are some movement disorders that can be caused that we also need to consider, especially if they're kept on the medication for long term. And so there's some testing that we may have to do at baseline and continue to do ongoing if they need to remain on those medications for long. Sedation is a big one that we have to monitor in older patients. Older patients have a harder time of removing the medications from their system, or what we call eliminating them, just because as we get older, our body just has a harder time getting rid of the medications. And so they tend to hang around a little bit longer. And because they're on so many medications, you have drug interactions and other medications that can cause sedation as well. And it just, all of those things start stacking on top of each other and accumulating. It just increases our risk of drug interactions and increased risk of sedation as well. And so those are a lot of the issues that we have to look out for.
As this patient's primary medical provider, how would you approach this case?
This is a tough case. When we think about dementia and the trajectory of the illness, we think of a very interesting, unique trajectory. With processes like cancer or heart failure, a lot of times we think of a slow downward trajectory that's fairly linear. What we more commonly see with dementia is stages of stability followed by events such as medical complications that cause the patient to go into a more rapid state of decline, followed by another period of stability. And so in these sorts of cases, I find it really useful to speak with family, caregivers, support people, and other staff members, and just provide them support and education about what they've seen. It can be very scary to watch your family member go through one of these states of rapid decline. And in this instance, we're going to have an opportunity to provide them with a lot of support by giving them education about the medical underpinnings of what they've witnessed.